Hi everyone, my name is Mark Morowitz. The meeting will begin shortly. Dr. Colfax will come on in a few minutes and begin speaking, so please be patient. Thank you very much. Dr. Colfax, please turn on your camera and microphone. Hi everyone, this is Mark Morowitz. I'm the Health Commission Secretary, and welcome to the DPH virtual update for community-based organizations. We will begin with Dr. Colfax in 1 second. Okay, Dr. Colfax, you're on.
Hi, good afternoon, everybody. It's really good to connect and reconnect so many key partners during this unprecedented time. I know in the last few months, our community, our families, our city has been under tremendous strain. And I just want to express my gratitude to all of you and your organizations as you have supported and engaged in our collective response, and let you know how much I appreciate that, the department appreciates it, and the city appreciates it. Because of your work, we have successfully flattened the curve of the pandemic, but it isn't without tremendous cost. And part of the goal of this meeting is to provide you with the context in which we are working, and then provide some additional information about our plans and how our plans will be guided towards the future. So we got one of our first slides up here, so I will just go into the presentation. Just to review the work that has been done, it seems a while ago now, but it was in February 25th that the mayor announced a local emergency, even before there were any coronavirus cases in the city. And then, as you all know, we issued a series of health orders, an unprecedented number of health orders, to better prepare and respond to the epidemic. And the one that I think is the most salient at this point is March 16th, the shelter-in-place order that was issued regionally, one of the most, if not the most aggressive regional effort in the country, with the understanding that this virus really, once it took root in communities without clear, without controls, that it would spread very quickly and quickly overwhelm our medical systems and our communities. That shelter-in-place order has been renewed, and most recently was reissued on this Monday, with a few loosening of some restrictions. But overall, the point is that shelter-in-place remains in effect. There have also been a number of other very important health orders that have been issued. I think many of you are familiar with those as well. But just to emphasize that from the beginning, our focus has been on preparing our focus has been on flattening the curve, decreasing slowing the spread of the virus throughout the city and throughout the region, preparing for a medical surge, so ensuring that there is, and continues to be a capacity of the local hospitals to provide effective care, both regular medical surgical care as well as intensive care unit care, so that we avoid as much as possible situations like we saw in Italy and in New York City. That we focus on the most vulnerable populations, people who are most likely to die from the virus, including people over the age of 60, and people with comorbid conditions, including cardiovascular disease, diabetes. That we also protect our healthcare workers and first responders, the people on the front lines, with adequate personal protective equipment. That we scale up testing to be able to diagnose people as quickly and as effectively as possible and support them and their families in isolation and quarantine. And very importantly, that we do this work through an equity lens, that we increasingly see, and as we anticipated, that this pandemic, this virus, will exploit existing inequities across the country, across the state, and unfortunately at the local level as well. So focusing on working with communities and ensuring that we're doing everything we can to support our collective response is going to be very important. It's important right now, and it's also very important going forward. Next slide. So this is where we stand today. If you haven't visited the COVID-19 response data tracker, I encourage you to do so. This is where we keep the statistics on our COVID-19 status for the city. You can see here that we have a total of 1,806 cases of COVID-19 diagnosed. Now remember, this is an undercount of our true number of cases because we haven't obviously been able to test everybody, and our testing capacity, while it continues to increase substantially, and in fact our rate is much higher in terms of testing than the state rate, but we still have much more to do here. But we've had a total of 1,806 cases. Unfortunately, we've had 32 deaths, and my condolences to the families and friends and communities of where those deceased were based. I also think it's important to emphasize that our death rate, while again any death is too many, our death rate is approximately half of the state death rate, and a quarter of the death rate in New York, where again the curve was not flattened. So I've said early on that by flattening the curve, we will save lives, and we now have quantitative data to back that up. Next slide. So these are our testing and diagnosed data. I'd like to first go to point out the cases in terms of race and ethnicity. And you can see that there is a overrepresentation of people of color diagnosed with COVID-19. What stands out in particular is the very high prevalence of the Latinx representation in COVID-19 cases. This is somewhat influenced by the mission study, that census tract study that tested over 4,000 people in 3 days, everybody in one census tract in the mission. But it also reinforces the fact that we see very high rates of COVID-19 in the Latinx community. For example, at San Francisco Zuckerberg Hospital, the health department's public acute hospital, we've had upwards of 70% of our COVID-19 hospitalized cases are identify as Latinx. And I expect there are several or more partners on this call who we've been working with very hard to ensure that people have access to testing, and as important to access to testing, that they have the services and the supports necessary in the Latinx community to help manage and support people who are both diagnosed with the virus and for their families and their neighbors as well. We've done a total of almost 32,000 tests at this point, an overall positivity rate of 8%. And you can see the date reported, the numbers of tests that have been done. Some of those peaks in the most recent days, for instance, May 4th, really do represent that very large research study that was done in the mission. Again, that was a research study, it was not a program. But you can also see overall that our testing rates have increased, while our positivity rate, which is shown in the jagged green line, that positivity rate has generally decreased over time. Last month, our positivity rate was as high as 12%, and that's gradually gone down. That is likely because we are testing more people. Now, remember, the positivity rate does not mean we're not getting more positives. It simply means that more people are being tested, and more of those are testing negative. Just to give you some context, and I'll talk more about this later, is we estimate in order to be in as full response mode as we need to be going forward, that based on data from researchers at UCSF and others, that we need to be doing about 1,800 COVID-19 tests a day across the city. I'll also emphasize here that these tests are not just the health department tests. These are tests done across the entire city system, whether they're private tests or health department tests as well. Next slide. So this is with regard to the mortality, the deaths in the city of San Francisco residents. We see similar patterns with regard to gender. There's a male predominance of deaths. That's consistent with national data and to a certain extent international data. We have said, as I emphasized at the beginning of the talk, that the people most likely to die from this virus are people over the age of 60, very much reinforced by the fact that 97% of our deaths have been over the age of 60. And then I also wanted to point out the deaths by underlying conditions, the comorbid conditions, what I was mentioning earlier, also in terms of vulnerable populations, that 31 of the 32 deaths had at least one underlying condition, and one death. There's not extensive medical history to know if there was an underlying condition there. In terms of race and ethnicity, these numbers are still small, so it's really premature to draw conclusions from this small sample size in San Francisco. But I do think it's worth noting that, I mean, it needs to be noted that half the deaths that have occurred were among people who identified as Asian. When we've delved into this data more extensively, that is the half the deaths among Asian patients is largely, we think, due to the fact that it's correlated with age, that they're the older age, and there also have been several cases that were linked with cruise ship travel. So compared to other populations that are testing positive for COVID-19, in this subset, Asians have tended to be older and are more likely to have reported a potential cruise ship exposure. I do think also we need to be vigilant with regard to what we're seeing at the national level, where morbidity and mortality is highest among communities of color, and especially among Black African American people living with COVID-19 in Black African American communities. So we are very vigilant around that through our equity work and equity lens, and we are going to continue to reach out to many community partners, including those on this call, to help us ensure that we are doing everything we can to mitigate that inequity that we're seeing nationally, from preventing it and mitigating it as much as possible at the local level. And I will just look forward to more of that work and conversations, but I've instructed the DPH team, and we are working across the city again to ensure that that effort is as optimized as possible. Next slide. So one of the key concepts that we have talked about and emphasized is the idea of flattening the curve. And this slide shows hospitalization rates of people with diagnosed COVID-19 from April 3rd to May 5th. And you can see that this curve is remarkably flat. The dark bars represent people in medical surgical beds in the hospitals across the city, and the light green on that chart represent the people who are sickest in the intensive care unit. I look at this chart carefully every day because it represents basically where we are in the epidemic in terms of the hospital surge numbers and how sick people are getting, and how much our medical system across the city is being strained by COVID-19 cases. So when I talk about flattening the curve, this is really the best data that we have right now in terms of the pattern of the epidemic and the strain that the epidemic is putting on our communities and our healthcare system. These data represent incoming data from all 9 hospitals across the city. And again, you can see that this curve has been basically flat since about April 5th. Some minor variations, but nothing certainly that would be statistically significant. The bottom bar shows the pattern for people who are in the hospital but are not yet confirmed COVID positive or negative. So these bars represent people who have symptoms or are otherwise suspected to be COVID positive, but the test is still pending. The dark purple show the number of people in the medical surgical beds, so the less intensive care beds in the hospitals. And then the light purple are the numbers of people in the intensive care units. These numbers fluctuate somewhat. They've been getting lower as we improve our testing turnaround time and capacity. There are times, for instance, you see here on April 5th and 6th, on April 26th, where those bars increase rather sharply. That is largely due to testing large numbers of people at Laguna Honda Hospital, because as for those of you who have been following this, we have had an outbreak at Laguna Honda Hospital. When we do test large numbers of people at that hospital, that's reflected in these bars. Next slide. So Greg will be giving a budget update next, but I did want to talk about some other key concepts that do not require a PowerPoint, but I think are really important points to emphasize. One is, as we go forward, I talked about the need to increase testing. And we are doing that rapidly, perhaps not as rapidly as we'd all like, certainly not as rapidly as I would have liked, but there are some key things to emphasize here. First of all, our collective response at the local level, regional level, and as I think, as you know, at the state and national level, has been very hampered by the lack of first good tests. The initial tests were not accurate and could not be operationalized as a result. We did not have a stable supply of testing materials. So much of our team's time was and continues to be focusing on very basic things like trying to get enough swabs, nasal swabs, oropharyngeal swabs for testing. And the media, basically the test tubes with the gunk to transport the tests. There has been no coordinated federal response in this regard. So we have literally been working with our city administrator, who's done just a remarkable job of helping us secure these supplies. But it has been very rough. It's been an undependable supply. We are doing better than we were, but it's still a big strain on our system and, quite frankly, on our community, because we certainly work to commit to I have articulated, and the department's goal is universal access to COVID-19 testing for all. And that universal access really should not depend on whether we can find swabs or test tubes. Unfortunately, that's been the situation that we've been in now for months. Having said that, we have dramatically increased our local ability to run the test. So basically the machines to run the test, our capacity there to meet this goal of 1,800 a day is not limited. We dramatically increased our testing capacity at the local, our department health lab. And we have collaborated very closely with UCSF and the Chan Zuckerberg, the Chan Zuckerberg Institute to dramatically increase our ability to actually run the test. As this testing as these testing efforts have expanded, we are now at over 25 sites across San Francisco that offer testing. We are offering through City Test SF, a collaboration of the health department, the Port of San Francisco, and Colors, a company that is running the system. We are now offering free testing to any essential workers in the city, regardless of symptoms, with the strong encouragement for such people to go get tested to know their status, with the caveat that being negative is not an insurance for getting infected in the future. Your test result, if you're negative, is only as good as that moment in time. But also assuring that people, if they are concerned, that they have, if they're working, they're unable to shelter in place, that they have access to testing. The other key component of testing right now is our focus on vulnerable populations. We have seen very high morbidity and mortality rates in nursing homes. We are now requiring nursing homes across the city to scale up testing of both residents and of staff, with the goal of testing these groups every 2 weeks. We started doing that yesterday at Laguna Honda. This will take some time to scale up, but we are definitely moving in the right direction in that regard. We're also focusing on other testing in other vulnerable populations, and we'll be expanding our testing capacity, particularly in populations in congregate settings. As you know, there have been outbreaks in several shelters across the city and in multiple SROs. And those are a focus not only for increased testing, but as in other cases where people test positive, that they are provided isolation and quarantine opportunities. Currently have over 200 people in isolation and quarantine hotels because they were not able to quarantine safely in their current living situation. And I think it's also very important to emphasize that we have identified and moved hundreds of people who are experiencing homelessness, who are members of the vulnerable populations, into shelter-in-place hotels. So hundreds of people over the last few weeks have been moved and are being supported in these shelter-in-place hotels. We are providing medical care, food, and with other city departments, other supportive services. So our testing expansion will continue. Hand in hand with testing is a need to develop our, strengthen our contact investigation, case investigation and contact tracing. We had a very small team in the health department that did this for other diseases like syphilis and HIV. We are now scaling that up. We've trained over 200 people to help us with this work. As we increase our testing, we will continue to increase our ability to do case investigation and contact tracing and offer testing to people who have high-risk exposures. That is being done in close collaboration with UCSF, and this is also going to be a regional effort with other counties. Part of this work from the beginning has been ensuring that we do this in a culturally appropriate and sensitive way, that our contact investigators have the training and are able to build trust with community and trust with many of the providers in the community, including many of you on this call, to ensure that we're doing this right. We know from experience that engagement from community members and support of community is absolutely vital, especially in the national environment in which this pandemic is occurring, and the xenophobia and the stigma and the discrimination that we have unfortunately witnessed at multiple levels, that we must confront that head on, be clear that it is not acceptable, and work most proximally with the communities most affected in order to optimize our collective response. Going forward, as we expand testing, as we expand our contact investigation, we are also going to be working with many of you and others in terms of developing a robust surveillance system, a warning system, if you will, to determine if and when the virus is spreading rapidly, that we are able to take aggressive and appropriate action to test and contact trace every person within that situation, so that we're able to tamper down the spread of the virus. We will also need to ensure that our medical surge capacity is robust, because as we've seen in other communities, even with an initial flattening of the curve, if things are opened up too soon, the virus finds a way to rapidly move through communities. Another part of our response and our ongoing response is going to be ensuring that people who need personal protective equipment or PPE have it. And I want to emphasize that while we have been at times, our supply of PPE has run low, we've always been able to maintain PPE, to provide PPE for our frontline healthcare workers and first responders in accordance with CDC recommendations. And we must continue to do that in this response. And we must continue to secure robust supplies of PPE as we expand our testing efforts. So going forward, many of you may, I mean, I get many questions about what's coming next. I think, you know, we have done just such an incredible job as a region. And again, I very much appreciate that. It's also, we are very likely in the second or third inning of this pandemic. If we look at the science and the patterns of these viruses, even with all the work that's being done with regard to developing a vaccine or other treatments, this is going to be at least an 18 to 24 month effort. We need to follow the data, the science and the facts, and be very thoughtful on how we potentially move forward with a gradual relaxation of shelter-in-place orders. But we will not be going back to the past. We will establish the systems that I talked about in terms of testing, contact tracing, surveillance, PPE, adequate hospital surge. But we also will need to be vigilant in protecting ourselves and our communities in slowing the spread of the virus. So if you think about it, the virus doesn't have a timeline, even though we would like to have a timeline. So we are going to have to be very careful, cautious, and iterate on what we learn as we gradually relax shelter-in-place orders, and be ready to flex up our response quickly. And we are going to, I'm going to ask all of you on this call to help us do that, because you have the best sense of what's happening on the ground, the best sense of what communities need to be supported through this incredibly challenging time. Obviously, they're not just the health effects are not limited to COVID-19 alone, although those are obviously incredibly important and need to continue to be a priority. But the overall health effects of the economic situation that we are in and we will be in for a while, the behavioral health aspects of dealing with this right now, and then the ongoing challenges that we have, the strain this puts on nonprofits doing the work, not only the health work, but the social services work. I mean, you know this, and my commitment is to ensure that we partner and that we work together going forward. So I'm going to stop there and turn it over to Greg with regard to providing a brief synopsis of where we are with the budget, and then we'll talk a little bit about next steps.
Greg, can you turn on your camera? Your camera and your microphone. There we go.
All right. Did I do it?
Yes, you did. I'm going to populate you, and then we can you can say hello, and I'll put up the slides when you're ready.
All right. Well, hello, everybody. It's good to, well, I was just going to say it's good to see you, but I don't see you. See a picture of a screen, but I miss seeing you in my kind of day-to-day interactions with you. And hope everybody is doing well, or as well as you can be, given everything that's going on around us. So I'm going to talk a little bit about a couple of the ways that we're working with our CBO partners and some of those opportunities that are going to be coming up. And then, as Grant said, about the budget itself, I know many of you have been communicating with the department through our business office, CBO meetings, through the DOC efforts itself. And that there's a lot of that going on, but we wanted to kind of start to establish this conversation. And there will be more as we kind of go through this process and into budget season. We've got some preliminary indications of where we are, but there's still a lot of uncertainty out there, and we'll be getting more direction in the coming weeks. So when that happens and when it's appropriate, we'll continue to reach out to you to work through this together. So if you can go to the next slide, Mark. All right. So I think most of you are probably aware of this, but on March 11th, so pretty early in the process, even prior to the shelter in place, and while the health department was starting to issue guidance on how to deal with COVID, Mayor Breed directed the controller's office and departments to issue a policy that is aimed at supporting nonprofit contractors as we go through COVID. We're aware that many of you have contracts that include payment based on units of service, and that the city is issuing guidance that essentially does not allow you to issue those units of service as people are sheltering and trying to socially distance. So the order, which you can find at the controller's open book website, and which is updated periodically, is essentially intended to provide a policy to provide continued payment to CBOs during this period while we're having our operations disrupted, and to try to be able to support CBOs to continue to pay their staff and to provide what services they can outside of the bounds of their usual contract structure. And so that was issued on March 11th, as I said. Has been updated multiple times, most recently May 1st, to extend that order in alignment with the updated public health order through the end of May. DPH has created a form that is on the CDTA website. And by the way, we're gonna post this presentation. I'm not sure where, but we'll communicate with that about you afterwards, so you can get these links, and there'll be some information in here that I'm not really going to touch on in depth. But DPH has created a process and a form for CBOs to engage with us on this continuity of payment during the emergency process, so that we can continue to support financially. Next slide. So a couple of the ways that we have started and will continue to be kind of working with a lot of our community partners on the response. There are a few things going. The first of these is at our Department Operations Center itself. So that's our big operation down at Moscone, along with all of our city partners that are managing the response. We've got a branch there, the Community Mitigation and Engagement Branch, and that is really the part of our Department Operations Center that is disseminating information. It is responding when we get questions or concerns from the community, trying to get information out there about vulnerable populations and how people can get guidance on supporting their communities, outbreak response, all of those. So that's something that's actively happening. I know that that branch has been working with and partnering with a lot of our community partners to try to help get information out, how to leverage the networks of all the organizations in the city to coordinate the response. There's an email for John Melichar on this PowerPoint, who's the contact for that community branch. So if you're interested in, if you have questions, if you have something that needs to be answered, or if you want to chip in and get involved, that's the way to do it. We've also done a lot of outreach and webinars and other guidance to various community groups. Next slide, Mark. So the other way that we are already engaging and will be continuing to engage is how we can work with all of you on the direct response. So Dr. Colfax went through some of the things that we're doing in response, creating this contact tracing infrastructure, creating alternative care sites that are meant to prevent hospital surge. We've got our containment operation, which is the hotels and other sites that are used to house people who need to be isolated or quarantined or are at risk in the setting that they're in. And so there are a lot of operations that we are building up in conjunction with our city partners. We have begun already with some direct outreach to a number of CBOs, probably folks on this call, to try to get some information where we have a particular need that we have been unable to staff and resource through our existing DPH operations, to get some information and talk about options for partnering with CBOs to staff some of these efforts, particularly where you have great expertise and ability to connect deeply with the populations that we're working with. So we've been working with some of those. There's going to be a more formal process coming up. We're planning to send out a survey to get a sense of capacity and ability for our partners to assist in this effort. And so this may be deploying staff to one of our containment sites to help support the populations that are living there. It may be outreach and community engagement, those types of things. We are looking for that help as we get continue to get deeper into this. And as you heard Dr. Colfax say, this is going to be a long-term proposition for us. It's a strain to have the resources to build all of this structure and all of this response as fast as we need to continue the good results that we've been seeing. So we'll be looking for your help with that. We do have a process in place for those who are helping in that way, where we have a emergency services authorization, which is essentially an emergency contract addendum that we would add to the contract to define what these services are and have a payment mechanism and reporting mechanism in place for those. So you can work with us on that. You can also reach out to, I don't think the email is on here, but the to either Michelle Ruggles, or there is a email address. Oh, it's on the next slide. So don't reach out to Michelle. Although she'll probably answer it. It's cdtaunit@sfdph.org. So that's a site email that you can reach out to if you are interested in talking to us about where your staff may be able to pitch in, or how we can partner together. So this slide, again, listing some of those opportunities that we have where we're going to need staffing capacity and a collective effort to really build out this structure and sustain it as we go through the response. So next slide, Mark. So on the budget itself, as I said earlier, it is still early and we're still waiting for information, but we do know that it is it's looking like it's going to be a challenge. We were actually had completed the department phase of the budget process when we, I think, really realized the gravity and the magnitude of the COVID-19 situation. In the budget instructions that were issued last fall, the city had projected a $420 million deficit over the coming 2-year budget. And then at the end of March, the controller's office issued kind of a revised order of magnitude estimate based on what they're seeing in the economic data. They revised that to grow potentially to between 1.1 and 1.7 billion. A very significant change in the financial outlook, and that is, I think, kind of self-evident around the city, where you see that there are empty hotels, there's no tourist travel coming, there are restaurants, there are other businesses that are shutting down, and all of that means reduced general tax revenue that comes to the city. And the scale of that is very significant. We've also seen, and this will be another burden for the city to try to respond to, is the human impacts of these economic changes are very stark, very significant increases in unemployment applications, and this will be a hardship for a lot of people in the city, and it'll be something that all of us in DPH and all of our partners will be, I'm sure, working through to try to mitigate the impacts for populations who are vulnerable to that economic change. We heard just today, the state of California issued an updated budget deficit projection that has grown to a projected $54 billion deficit. That is not good, as they say in finance lingo. The impact of that, the state has been working on building reserves, as has the city, but the impact of that is large, and that probably limits the ability that we'll be able to depend on the state to support us through our response on an ongoing basis. State has been very, very supportive in trying to help local city and county governments in the response to this, but that budget projection is an indication of some of those limits. We are actively pursuing state and federal emergency reimbursement. You've probably heard about some of the stimulus packages that the federal government has passed. We're already seeing some of those dollars come in to the health department for reimbursement of lost revenues and increased costs associated with COVID. So that will help offset some of the difference. The controller's office is also leading all of us on gathering all the data about our response so that we can submit claims to FEMA. And we hope that will, again, yield some federal money that will help offset the financial impacts. But we do, looking at the economic data, expect that this is going to be a challenge. And so we will be, like I said earlier, we'll be continuing to talk to you as we go through this process and try to work through the challenge together. You can go to the next slide. So timeline, right now, the city is in the process of updating its financial projections. So that's looking at what's happening in the current year, which will end at the end of June. We've seen in our financial projections a very significant change over this last quarter of the fiscal year. The controller's office is gathering that information to try to balance and then to do a projection, an updated projection for what the changes in the economy look like through the end of through the 2-year budget horizon that's coming. And we expect that mid-May, so within the next week to 2 weeks, to have a much more clear picture and some instructions for the departments on how we are directed to respond to that. The mayor's office has essentially taken the budget process and pushed it back 2 months, given that like I said earlier, the COVID pandemic came right as we were leading into our normal budget season, and given the scale of the changes, made a decision to push things back 2 months. So that will essentially mean that the budget process will all the milestones in the budget process will move back 2 months. So we'll be working with the mayor's office to do revisions to our budget. We don't, I didn't word this very well, but we don't expect that 2-month delay should affect the way that you're paid. We'll have to work through the mechanics of how this goes, but we're working on that from the practical impact of the alignment of the fiscal year with the way your contracts work. And then we would have, again, 2 months later, our usual Board of Supervisors hearings and approvals in the month of August and September instead of the regular June and July. So again, we don't have a lot of clarity, but wanted to start just kind of initial conversation with you, and there will be more to come as we get direction from the city about where we are, about how we're going to respond. I will say, I think everybody in the city, DPH, all of our partner departments, the mayor's office, the Board of Supervisors understands that even though we're in a financially difficult situation, that the COVID the response to the COVID pandemic, a lot of the things that Dr. Colfax outlined are going to have to be a priority, and we're going to have to keep the pressure on to make sure that effort is sustained, and that is going to be a focus of everybody on the city side, and I think with all of our partners as we go through this the budget process. So I think that was the last one that I had, right, Mark?
That is.
All right. So I'm looking forward to seeing many of you again and more conversations about the budget to come.
Great. Dr. Colfax, any last words before we end the event?
Yeah, so I just wanted to acknowledge that the governor is releasing some criteria for the gradual reopening. I think that's happening perhaps as we speak, and that we are very focused on ensuring that we maintain the gains that we've made with our COVID-19 response and flattening the curve, that we will continue to follow the data, science, and facts, focus on the most vulnerable as we ensure that we are responsive to communities that are and will continue to be most disproportionately affected by this pandemic. And that we have to be very thoughtful as we move forward to this new future, that the virus doesn't have a timeline, and that our timeline of response really needs to be followed by the combination of science, data, and the information and wisdom that we hear from providers and the community, and that our partnerships are more important than ever. The strengthening of our ability to work together is going to help us in our response. And I just really want to thank everybody on the call today for your partnership, your sacrifices, and your resilience as we move forward through this together. And just to reinforce what Greg was saying, that this is not a response from the city that is limited in any way to DPH. This is obviously a public health crisis, but the mayor has been focused on this from day one, following the science and the data, taking aggressive early action. We are working with the Emergency Operations Center, which has multiple departments in the city helping us be responsive, and that work will continue. As I said, we're only in the second or third inning of this process. So thank you again for your time. I hope this was helpful. I encourage you again to go to the tracker to follow where we are. This meeting is being recorded, so if your teams would like to listen, there will be a website provided for that. We are also working to create technology so there can be more ability for people to ask questions, and hopefully at the next meeting, at the very least, we can ask for questions in advance, because this cannot be a one-way feed of information and dialogue. Our technology has evolved, so I will ensure that as we have more of these meetings, and we will schedule another one fairly soon, that we have more ability for more back and forth, because I can only imagine that while I tried to do what I could to answer some key questions during this time, that you likely have many more. And obviously, you know that there are other places to ask those questions, and other people and who to contact at the department about that as well. But in the future with these meetings, we will not only be doing updates, but also hopefully be able to have some dialogue back and forth. I miss that. I'm sure you miss that, and we will figure out how to make that happen. So thank you, Mark. I don't know if you have anything else to add, or if we have that location or the time when this meeting will be available.
No, everyone, we will be sending out the link to the video of this meeting, as well as this PowerPoint, sometime this afternoon or tomorrow morning, and we will get back to you with future dates as soon as possible. Thank you all.
And also remember, take care of yourselves, do your self-care, take care of your families. That's how we're going to help our communities and our city. So thank you very much. I'm proud of the city, and I'm grateful for our collective efforts going forward. Have a good afternoon, everyone. Bye-bye.